Tobacco does not relieve stress. Tobacco does not cause people to become thin. Tobacco is the most addictive substance in the world, more addictive than cocaine and heroin, I can assure you. Healthy weight by appropriate diet as well as exercise on a regular basis.
Hello everyone, welcome to the new episode of OncoDaily India, and my name is Fulkan Ashmi. And today we are honored to welcome Dr. Ravi Mehrotra, a leading physician researcher in cancer prevention, pathology, and public health, an affiliate investigator at Fred Hutchinson Cancer Center, and adjunct professor at Emory and the Brunel University. Formerly leading the National Institute of Cancer Prevention and Research, he founded the WHO Global Knowledge Hub on smokeless tobacco with, I think, 300 plus publications in the top journals and key role in WHO IARC and other global bodies. Dr. Mehrotra's impact on cancer research is profound. Welcome, Dr. Mehrotra.
Thank you so much, Dr. Hashmi. It's a pleasure to be with you.
Thank you, Doctor. I would like to ask you, Doctor, to give a short brief from your side also for my audience.
And as you have very kindly mentioned, my work and my passion is for the last many years been focused on prevention of cancer rather than treatment. There are many oncologists, obviously, around the world who are focused on the best treatment for cancer and ideal situation regarding the control overall across the world. My focus has been on early diagnosis and primary prevention of common cancers, especially focusing on the lower middle-income countries, where, as you well know, as per the latest figures, more than 2/3 of cancers are going to be occurring in the lower middle-income countries, including countries in Asia and Africa. That has been my focus, and I've been trying to, in addition to my own research, I'm also mentoring a lot of youngsters as well as mid-career workers in the areas of specifically cancer prevention as well as early diagnosis, which is, as a pathologist, that has been my focus. And the common cancers that I work on, as far as LMIC is concerned, include oral cancer and cervical and breast, of which, of course, cervical and oral both are eminently preventable, and we can talk about that as we go along.
Yeah, sure, Doctor.
So that has been my focus of trying to get affordable cancer care, get affordable cancer diagnostics, as well as to prevent financial toxicity due to cancers.
Thank you, Doctor. Thank you once again. So I would like to start from the very first question, what trends are oncologists observing in tobacco-related cancer in India, particularly in terms of incident, treatment outcome, and patient demographics?
Unfortunately, as far as India is concerned, number of tobacco-related cancers is increased, especially include the ones that are oral, lung, and esophageal cancers. The incidence is rising, especially because we have a very large population which is relatively young, less than 30 to 40 years of age. That is the time when people are initiating tobacco use, and tobacco being the single most preventable cause of head and neck cancer as well as lung cancer. It is rather unfortunate. Although the percentage of smokers has gone down as per the latest GATS and the GYTS surveys, but since our population is still rising and it will keep rising for at least the next few years, actual numbers have gone down. Unfortunate thing is, unlike the West, chewable or smokeless tobacco is a major contributor. And also the rising number of women who are started smoking or taking bidi is also a concern.
Yeah, that's exactly. So your study, published in this 2025 January, explored the most effective and cost-effective social media ads for promoting the smoking cessation app. That's I Can Quit, right? So can you briefly introduce the I Can Quit app and its role in helping people quit smoking?
Dr. Hashmi, one of the first things that people do nowadays to get information is open their cell phone or look at the internet. And mobile health is one of the areas where there is a very rapid growth of information, as well as the WHO, the NIH, and many other organizations have started using the mobile technology for this purpose. So in my work with the Fed Hutch, I collaborated with them on an I Can Quit app. A digital app designed to help individuals quit smoking, basically, but we are hoping to expand it further to smokeless tobacco. Provides a personalized quitting plans, education resources, motivational support, community support, as well as, since the app can be easily accessible from mobile phones, increases the number of people who utilize it, hopefully. We have converted it and adjusted it to suit the Indian scenario. And we are hoping that we can get, and it is free, so it is being helped by philanthropy at the moment, but we are hoping that to get corporate responsibility, social CSR funding to actually make sure, or the government's participation to make it freely available, not only in English at the moment, but we're hoping to convert it to regional languages and also add smokeless tobacco, as I mentioned. Hopefully that will improve the number of people. Although many people have downloaded it, we are still to get into the, since it was launched just about a year and a half ago, we are hoping that many more people will utilize this benefit. It has, in a random clinical trial, which, as you know, is the highest level of accuracy and reliability as far as clinical trials are concerned. In the US, that has been shown to be taken up and then benefiting more than twice the number of people who have taken or used the government app. So it has a known efficacy of the increased number of people who are benefited by quitting the tobacco or quitting the smoking. We are hoping to do a further study in India where we see how many people have actually downloaded, how many have used it, and what has been the quit rate. At the moment, the cessation facilities available in a country like India are very, very few. And also, nobody has done scientific study, random clinical trials, for example, to see how many people have benefited and what is the actual quit rate. This way, we hope to empower individuals to take control of their tobacco addiction and provide them with the necessary tools and support to achieve long-term abstinence.
Yeah, sure,
I
Doctor.
hope that answers your question, Dr. Hashmi. Yeah, please go ahead.
Yes, Doctor. And I also like to advise them to download this application and try, and also ask their peers to download. And I will also provide the link in my description of this video.
Right, Dr. Hashmi, it is available both on the Google Store as well as the Apple Store, and it is available free for people in the subcontinent.
Yeah. Thank you for the information, Doctor. And Doctor, like, what strategies can we implement to reduce the socio-economic and educational disparities in cancer screening uptakes among Indian women?
Indian women. Okay, that's a very appropriate question because the women are the ones who are least screened as far as India is concerned. So we have our 3 or 4 points where I can talk about it. Of course, there is a need to strengthen community-based programs and implement screening programs in rural and underserved areas, utilizing, as I mentioned earlier, using mobile devices as well as community health workers. With the increasing penetration of the internet all across the country and also the fairly economical as well as affordable cost, I think using the internet and using mobile phones and as well as tablets by the community health workers, not only to improve the screening, but also to keep a record. And also if there are any dropouts or people who are left out, making sure that they get the benefit of screening is extremely important. So also it is important to engage the local leaders, community members, the politicians, the religious leaders to build trust and promote screening. Because screening, as you know, Dr. Ashmi, is looking or diagnosing early lesions when the people are absolutely asymptomatic. So when you talk to a woman who's working in the field or doing a household chores, says, I have no problem. Why should I bother about getting screened? They should be once. I will only approach a doctor once I have a problem. Of course, screening happens in asymptomatic individuals. So thus, maintaining accessibility, affordability, as well as the trust of the individual, as well as effectiveness are extremely important. Similarly, education initiatives, for example, conducting culturally sensitive awareness campaign in the local language to educate women about the cancer risk and the importance of screening are extremely important. Doing it at appropriate time, for example, when schools are off and the non-working hours are there. So it is important to get the elders of the family also aware so that they have the full support, especially in rural areas. Addressing misconceptions and cultural barriers that hinder screening. For example, people have all sorts of taboos and misconceptions that, if I'm screened, that I might actually get cancer. So those sort of very, very basic things have to be answered and have to be addressed. So the local health providers, community health workers are extremely important. So similarly, financial assistance. For example, if you detect something, it is important that especially lower income women, that you provide them with the necessary transport, provide them with treatment facilities, with the new Ayushman Bharat, as well as the various insurance schemes by states. It is important that these individuals may not have access to them. They may be scared of approaching the government or may not even know how to do it. So those barriers have to be done. So there is a program called the KWAT, which is kind of a navigator. So those individuals help patients to not only get the care, but also ensure that they are followed up and get the appropriate financial resources if needed. So expanding the health insurance coverage now, as from, I think, the next financial year, everybody over the age of 70 who is also eligible, in addition to the lower 30% of the country's eligible population, so that the number of people who will be eligible for the health insurance scheme from the government is going to increase dramatically. So I hope cancer screening results will also be followed up in the appropriate fashion. Lastly, making sure that healthcare is accessible. The screening facilities are available, which are very few and far between, you know that at the present moment, and training healthcare workers to provide these screenings and appropriate follow-up at the doorstep. These are some of the few things which I feel are important. They are not easy, but given time and effort, they should not be too complicated. I hope that answers your question.
Yeah, sure, doctor. It's like really well you said, and even I agree about like the you said about. And following the same, I would like to ask you, what like the effect, is it effective, like anti-tobacco awareness program in schools and colleges, and what are the most common misconception among the young people having about the tobacco use?
As far as effectiveness of these programs are concerned in schools and college-based, they have to be interactive, long-term, and include the peer leaders, as I mentioned earlier. So effectiveness, obviously, at that age, is people are, when you are in school, people are least bothered about things like cancer, but that is very, very far off in the horizon. But well-designed programs that include peer education and media are effective. They has been shown because as the cricket logo used to be for the cricket team of India, that catch them young. So if you can actually prevent and ideally prevent by maximally delay the tobacco initiation at the teenage or the adolescent level, that is the best. So if the kids don't take up tobacco, that is the best way of tobacco control, or people not even getting into it. So, the tobacco companies are very keen to position tobacco as something which is very aspirational, in the sense, if you are smoking or chewing, then you become smarter, you are more attracted to the opposite sex. And also, people find that it is the social taboo to break anything which is forbidden is always kids are adventurous and they want to explore new avenues. So unfortunately, the role of film stars, as well as cricketers and various other sports people, is very important. So now the government has fortunately stopped the tobacco advertisement in various sports events, at least, but unfortunately in the garb of surrogate advertising, our film stars are still very keen to promote products from these various tobacco companies. The product they themselves may not have tobacco, but they have the same advertising logo and the same kind of colors, and that is how these people are advertised. So young people are very susceptible to icons that they follow or they respect to follow what they are doing, and tobacco companies are more than happy to do it. You know that very well.
Yeah,
So
yeah.
there has to be long-term, sustained programs that are effective rather than one-time intervention. So there are various school health programs. There are various advertisements which are supposed to be there of a toffee, which is a tobacco-free education institution. They are effective, but obviously more research has to go how effective they are. But the best advice would come from parents, elders of the family, as well as the peers. So there is a program of tobacco ambassadors being made in various schools, and the school teachers being involved in this education. That has proven to be the most effective. So the family involvement, of course, is extremely effective. And the best way to involve youngsters as far as family is concerned, but the elders not taking tobacco themselves. Quite often it is seen, Dr. Hashmi, that you ask the younger kids, especially the grandfather or the uncle, ask them, okay, please go to the tobacco shop at every corner and please buy me some tobacco.
But
So obviously, if the person goes and buys five pan containing tobacco or cigarettes or bidis, they will take one or two themselves. So it is understandable. So
or even trial.
absolutely. So why I said kids are adventurous. That is the way kids are all over the world. And once you try, it is obviously very easy to get hooked. Tobacco is the most addictive substance in the world, more addictive than cocaine and heroin, I can assure you. And it is extremely, once you get onto the habit, it is very, very difficult to get rid of it. And that is what the tobacco industry, as I mentioned, tries to do, is catch them as young as possible so that at least they have a consumer, which is be with them and spend money and, make their pockets heavier over the next 30, 40, 50 years. You'll be surprised. Rather, you won't be surprised, but it is just easy to remember that tobacco industry is the only industry which kills practically half of their consumers over the long period of time when they are consuming tobacco. So that is when you are killing about 50% or thereabout. Obviously, you have to get new consumers to keep on adding to their profits. So it's big tobacco is obviously our organizations which thrive on new people joining their fold, and they don't care what medical problems they have or what socioeconomic problems or financial issues their people are facing. Not only the individuals who are consuming tobacco, but also their families and friends. And as far as smoking tobacco, BDs and cigarettes are concerned, of course, there's the problem of second-hand smoke as well. That you know very well. And third-hand smoking or third-hand tobacco at the same time. Maybe we can have another conversation on that some other point.
Yeah, exactly.
There are common misconceptions that they are low or light tar cigarettes are safer. Chewing tobacco is less harmful. Obviously, it is not. The recent survey, a paper that came up earlier this year in 2025, they said that it is caused exactly the same harm. Of course, the harm is more in males because more males are using chewing tobacco and also smoking. So occasional smoking or chewing is not addictive. Of course, it is addictive. That is how they start it. Just because it is normalized, everybody is doing it, that doesn't mean it is safe. Then newer techniques like newer devices like vaping or the electronic cigarettes is definitely not a safe alternative. As a matter of fact, people get hooked on to electronic cigarettes and then it is very difficult to cease or then to leave that habit. And the country, fortunately, along with my colleagues, we could actually recommend that this should be banned, and it was banned by the government which about 4 or 5 years ago, but we all know it is available in the black market. So, and tobacco does not relieve stress. Tobacco does not cause people to become thin, but the amount of money that is spent on tobacco also, as I mentioned, gives rise to various socioeconomic problems, health problems, as well as causes deleterious effects. I don't think tobacco has any single positive result in the world.
Exactly, exactly. You
So they are warning labels and so on. Yeah, please go ahead.
yeah. You actually I would like to follow like your previous the question, but most of you you already replied very well. So, but still, I would like to ask, what additional policies or strategies do you think need to combat this issue? Are existing tobacco warning labels and advertisement effective in discouraging young user. Most of the thing you already replied, but still I would like to
Right. No,
ask
thank
you
you, Dr.
because
Hashmi. That's
really very
very,
no, yeah.
very pertinent questions. See, there's many studies, including from the WHO, and I was involved in some of them, uh, come up the single best way of increasing the effectiveness of tobacco control is increasing the taxes. So in the West, especially in countries like Australia, as you know, I mean, a pack of cigarette will cost you about $5, which is an extremely high amount of money. And then they have seen and even in the US, the number of people smoking has actually gone down dramatically. I think from about a high of 30 to 40%, this come down to about 12%. While in India, we have from about 28, we are now to about 24% or so as per the last survey. Of it may have gone down further, but we would love to get it in single digits. So increasing taxes 4 times, 5 times the MRP, 10 times if possible, is probably the best way. With the GST that has been introduced, the prices have actually gone down a little bit rather than gone up overall. Especially smokeless tobacco, because the base price is so high, so low, it is actually less than about 2 or 3 rupees. You can easily buy tobacco products mixed with areca nut, which is another problem, which areca nut itself causes oral cancer as well as oral submucous fibrosis, you know very well. Most people do not consider areca nut or supari as anything which is bad, and it has been culturally accepted. But now when people are having in the kilos and huge quantities over a long, long period of time, it becomes very difficult for people to leave that as well. So there is areca nut addiction at the same time. So increasing taxes is probably the best. Enforcing strict regulation from tobacco advertising, surrogate advertising already talked about, especially near schools and colleges or religious places, is forbidden, but we all know it is, in reality, it is not implemented so very well. Fortunately, the smoke-free zones in public places, at least in the cities, you will not find people smoking in public places. Railway compartments, people generally do not smoke, but of course they do chew. So expanding these smoke-free places is important. Providing accessible and affordable cessation services, including um, use of mobile health programs like I Can Quit. They really should get sponsorship from the government and support, which are freely available. It has been shown to be effective, along with non-nicotine replacement products like chewing gums and lozenges, as well as certain medications, should be available. Every medical and dental college in the country is supposed to have a tobacco cessation center. Of course, they're still coming in place and needs to be strengthened. So at the same time, one other issue you might have seen, Dr. Hashmi, is single stick cigarettes. So एक सिगरेट पी मिल जाती है आराम से, जो कि actually banned है. But it was a single cigarette may cost relatively a small amount of money, but when you buy a packet, it is much more. So regulation of e-cigarettes and vaping, a more effective way. If it's already banned, it should not be available. I mean, I don't think anybody would argue with that. Similarly, there are warning labels of 85%. They're warning, unfortunately, they need to be replaced now. People have got tired of seeing the same warning labels over the last so many years. They have been shown to have some effectiveness, but the impact can diminish over time. So regularly updating and strengthening the warning labels is important. The labels are more effective when combined with other anti-tobacco campaigns. Many young people get desensitized to the current way warning labels. And, selling things like biscuits or cookies or toffees along with cigarettes or along with tobacco is a common problem, especially with small vendors. And tobacco vendor licensing is another issue which really needs to be looked at, so that they know how many vendors we have and their presence can be controlled. I know all these things sound very difficult, but if there is a will, there is a way, as they say. And there's no way, there is no reason why they should not be implemented, because it is the future of our next generation in the country, as well as their own well-being, not only mental but also physical well-being, which is important. So I think these are some of the things that you can do. Of course, each of these I can talk for half an hour, which I will not do at this point, because this particular meeting is more of a 360-degree view rather than an in-depth analysis of all the reasons where we can. Thank you.
Yeah, exactly. I hope like in the coming years, it will go to the single digit even in India. I hope.
I hope so too.
Yeah.
I pray for it.
Yeah. So, what is the one key piece of advice you would like to give to the young generation and how they can contribute, like raising awareness and preventing tobacco addiction among their peers?
Well, the advice that I can give to uh, youngsters and younger generation, that your health is your most important asset. Protecting it by staying away from tobacco of all forms will be very useful. If it, ideally, you should be a role model for your peers and younger siblings, if any, using your voice to challenge the normalization of tobacco and encouraging your friends to quit if they are struggling is will be extremely important. I would invite youngsters to join the efforts done by my own organization, which is the CHIP Foundation, which stands for Center for Health Innovation and Policy Research. As an ambassador, as a volunteer, it doesn't cost anything at all. And a lot of information is available on our website as well. And I'm sure you'll be able to help with the link to the website. So
Sure.
educating yourselves and others about the dangers of tobacco, using social media, people would listen to your peers, they would listen to you and to your role models rather than listening to doctors. So that would be very useful to help spread awareness. Rather than sending good morning and good night messages on WhatsApp to your colleagues, it would be a good idea to send motivational or informational pieces on tobacco, for example, and for cancer prevention. So being aware of the tactics used by tobacco companies to target young people, question the messages that you see in advertising and entertainment that portray tobacco as a glamorous, um, kind of a aspirational object or harmless. Seek out accurate information. Another word I would like to talk about the girls, especially the age between 9 and 13, to their parents and their elders. It is very important that now the government is hoping to introduce a cervical cancer vaccine, which is against a virus called human papilloma virus, HPV. So cervical cancer is one of the very, very few cancers which we have a vaccine. The other one is, of course, liver cancer with hepatitis B vaccine. So taking the vaccine at the appropriate time, now it is the number of doses has also reduced from 3 to 2, and now they're talking about a single dose. Getting screened at regular intervals at their nearest health facility will actually bring the cervical cancer cases. And the HPV vaccine, as you also know, is ideally given for boys as well, up to the age of 26, to prevent oral, penile, anal, and various other cancers. So this is one area, and now it is being made in India. The prices are going to be hopefully very, very reasonable in the next year or maybe two. So making sure that everybody who's eligible gets the HPV vaccine through your channel, I think is extremely important. So my sort of take-home message, if I may give you, would be go for HPV vaccine. Go, and just do not take tobacco. Make sure that you are maintaining a healthy weight by appropriate diet as well as exercise on a regular basis. I know these things sound very, very basic, but so many people just don't bother about it. Either they are not aware or they just don't care about day-to-day life is so difficult at any age that people just don't bother. But if you want to maintain a healthy as well as a long disease-free life going further, I think youngsters are the focus where I would like to put my money, that they themselves should be careful and also ensure that their parents or older relatives at least know about it. Very interestingly, to leave tobacco, for example, people who do listen to their girl child specifically more than their boy child, if they have any. The boys, they don't give so much importance. But if a young girl comes and hugs the father or uncle or a grandfather and say, look, I will not come near you if you are is continuing with your smokeless tobacco or continuing with your cigarette or bidi, that quite often makes a huge difference. So children, especially teenagers or mid or high school students, coming as ambassadors of cancer prevention and tobacco would, in my view, would be an ideal situation. And they should be suitably recognized and rewarded. I hope, I know I'm asking for the moon, but even if small starts are there, it will make a huge difference going forward.
Exactly, doctor. Exactly. I hope this interview will help youngster and like peers to get more and more information and try to implement in their daily everyday life to prevent
Thank you.
and get rid of the tobacco. Thank you, doctor. And doctor,
And
once again,
today also happens to be Eid and the last day of Ramzan. So as they say, inshallah,
yeah,
God willing, we will get what you want to do.
yeah, doctor. And thank you
I'm
for
very
accepting.
hopeful.
Thank you for accepting our invitation, doctor, and thank you for your insight and impact on global cancer research. And really, we appreciate your time and dedication. Wishing you continued success. Thank you, doctor.
Thank you. Thank you so much for having me. And I wish you the best in your efforts of spreading awareness about these very important issues. They're not only important in developing countries, but practically all over the world. All the
Thanks,
best.
doc. Thank you, doctor. All the best. Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.